Well, today, many families and doctors across the nation are concerned with an increase in reported cases of whooping cough. It's a multifaceted respiratory disease which spreads quickly but is not always easy to get rid of. News 8's Ryan Hermanet spoke with health officials at WROC about why we're seeing more cases this year in New York and how you can prevent yourself from catching it. Ryan.
Although I'm told that here in Monroe County, the number of whooping cough cases has not jumped dramatically this year, New York State currently has the second most reported cases of it in the nation overall. This is why health officials are urging people to know what the disease is, how it spreads, and some steps that you can take to keep your family safe. Pertussis, commonly referred to as whooping cough, is a bacterial disease that we're seeing more cases of across the United States this year. And even though there are 5 times the number of cases in the nation this year compared to last, the increase is not surprising.
And it seems to come around in waves every couple of years, every 3 to 5 years. And we seem to be in a wave year of pertussis.
It's a disease that starts with cold-like symptoms, runny nose, low-grade fever, and congestion, and progresses into a cough that can become so aggressive that it takes nearly all of your breath away. It can be serious if contracted, especially in children.
The biggest concern for me as a pediatrician actually is the young infant, the infant under a year of age, because those children can get enough complications, not just from the whoop and the cough itself, but pneumonia, breathing pauses, and rarely death.
The biggest worry for adults, though, is the progression of the cough, but the vaccine continues to be an effective preventative step to take, along with covering your nose when coughing and sneezing, washing your hands, and staying away from those who are obviously sick.
Sometimes the cough is so violent in older kids or adults that we've heard of people breaking ribs with their coughs, so it's really a disease that's sort of nasty and that we wish to avoid. That's why it's so important to get the routine immunizations that children do. If we could make sure everybody was vaccinated all the time, and as we get better and better vaccines that work better, I think we'll be on the way to reducing pertussis.
Now, Dr. Weinberg added that this wave cycle is comparable to what we see each year with many bacterial diseases, such as influenza or walking pneumonia, which is why practicing these preventative tips when in highly populated areas like schools and daycares is crucial. Also important to know, the pertussis vaccine is commonly administered as a combo, which also protects against tetanus and diphtheria as well. We'll have more info about these types of vaccines and on pertussis in general available to you on our website at rochesterfirst.com. For now, reporting outside the Golisano Children's Hospital at the University of Rochester Medical Center, Ryan Hermanet, News 8.